Superintendent Oshner?
Deputy Superintendent.
For the purpose
Well,
of this question.
I guess, with all due respect, we have, as you can imagine, a different view of it, and we fought very hard to make sure that sale across state lines did not happen, and in fact, we were successful on that regard. And the reason is, not because we're anti-insurance company as such. It's more that we're concerned, think about it, if insurers could get regulation under any state and sell in any state, you're going to have an absolute race to the bottom. That all of the consumer protections that we've worked so hard for in New York State are out the window, and New York State would be a big fat plum for any out-of-state insurer, not to pick on wherever the least regulated state is, house themselves there, and then come into New York, ignore our community rating rules, our other rules that really protect consumers. And so we felt in New York that we needed to do that. But just to clarify, there are national insurers in New York, United, WellPoint, Aetna, etc. They are and they do operate in New York, and they do bring their national capital to bear to try to gain market share and undersell their competitors, and it's a very competitive market in New York. But we do it along New York rules. And while there's some insurers the national ones who did favor sale across state lines, there's others, the regional insurers, particularly upstate, who are very much opposed to that proposal. The one thing that I will just mention lastly is that there is a provision for these healthcare cooperatives, and remains to be seen when we get guidance from HHS exactly how that's going to unfold. But there is, concern on the state level to make sure that, however these cooperatives unfold, that they are having to comply with state consumer protection rules.
Okay, we have time for a couple more questions. That gentleman over here, I know Peter.
Hi, good morning. Dr. Satterfield from Queens, past president of the Medical Society, and I thank you for an excellent conference. I do need to just get back to one point. And as we do face maybe 6 or 7 insurers in our state, the problem that we're having as physicians, because we are small businesses also, we provide the corporate tax, the state and local tax of our communities. We provide, we're the 6th largest industry with employment in our state, and we are small business practices also. And we have the same problem you do. The problem that we have is that we're the ones that provide the service to each one of you. And you want us at the top of our game. You want us to know our material. You want us to be good with what we do. And we can't do that when we're in the present climate that we're in now. The insurance companies, we cannot collectively bargain. We cannot negotiate. We are shackled by antitrust laws. And therefore, we have to accept what insurance premiums present us. And those keep sliding down. Our pay scale keeps sliding down. And even now, when you talk about the insurance companies and what's going to happen, they don't have to pass the cost along to the consumer. All they have to do is reduce the reimbursement to the provider or the physicians. And that's what's happening today, not in 2013. It's happening today. We had 3 hospitals closed within 1 year in Queens. 3 hospitals.
But
Why?
that's hospitals versus physicians. You
That's hospitals.
You got to separate the two.
But they both have the same problem: the ability to negotiate with the insurance companies.
I completely disagree.
And
the hospitals are the hammer right now in this marketplace.
Yes.
Just, you want to finish your question, please?
Yeah. Well, the question is this. It's not a question. It's more of a statement.
Okay.
Physicians need to be able to better negotiate their rates so they can get better reimbursements, so that they can survive, because many of them are going out of business now. And they cannot survive under the present climate of increasing cost and decreasing income. And no business can survive that.
Joe, you want to take that from your past life?
I think certainly, there's going to be a lot of change and I mentioned a little bit in what Medicare is doing in reimbursement reform. And I think that can take a lot of form. And of course, doctors in the state, as well as the AMA and other national associations, were, very involved in the formation of the bill. And, we could argue about whether or not, the hospitals in Queens that closed, whether, at the end of the day, bolstered other hospitals that were also, in dire straits out in Queens, and whether that the right mix is currently in the community or not. There was a tremendous investment made by the state in community health clinics and other providers out in those Queens neighborhoods where there had not been investments in the past. And so I think the story has yet to be kind of finished in whether or not the right resource mix is currently in those Queens neighborhoods or amongst those Queens hospitals. But I think, Lorraine can, and who I work with quite closely on some of those issues, can speak to some of the problems there in reconfiguring the health delivery system in that area, which was done on a kind of crisis basis, and which I think what we're trying to do now in the context of health reform, and doctors' voices will certainly need to be heard in this regard, is change the way we pay for healthcare completely. So moving away from a fee-for-service model and towards a more bundled payment model, towards, for example, different configurations of doctors and hospitals and groups, some of which we see on the West Coast or in mountain states, or even in more rural areas like north central Pennsylvania, but we haven't necessarily seen in the New York market in a big way. Now, you can say that's a bad thing or a good thing, and we'll need to make that decision in New York amongst a lot of different stakeholders. So I don't think anybody would disagree with you that there needs to be attention paid to the supply, and of course supply is partially contingent on demand, as we've heard already, and Massachusetts has responded to that in a certain way. I think rates are going up for doctors in the Medicare program. At the same time, we've got to solve the whole SGR situation as well, but primary rates will go up, and that has been solved over the past 10 years, not in the right way, in the sense that it should be resolved once and for all, not on an annual basis. But and we certainly are committed at the Medicare Rights Center to working with doctors to get that solved, get that done and eliminated. So I think there's a tremendous opportunity for doctors, insurers, hospitals, etc., to fix this ongoingly, because this health bill, I think, creates a platform to do a lot of what we've talked about today, but it doesn't necessarily create all the structures on that platform, particularly in the cost containment area, and a piece of cost containment is reimbursement, but that doesn't mean it's only about cost containment, it's about presenting the right incentives. So I agree that those incentives need to be there in order to have the right medical professionals with the right incentives to provide that high quality care.
So let's sum up. I'm going to give each of our panelists a minute for closing statements. Joe, why don't we start with you?
I guess the only comment I'll make, because I've made it a few times, is that, again, I think socially this is the right thing to get people covered and get them into the system. And I'll just build upon the comment that was just made. However, we just need to change the reimbursement model. The world that we live in, that's adversarial between, insurers and hospitals and doctors, and even hospitals versus doctors. I mean, there's all this nonsense that goes on in the middle. If we keep our members, if we keep our population healthy, that's good for the system, and we actually have all the tools, the data, the information, and a lot of the infrastructure to do that. So I'm optimistic that we will get to that place. It's going to be a little painful, I think, over the next 4 or 5 years to get closer to it. But I do think that over time, a lot of the real innovation around health reform is going to come out of this enacting of a legislation, but driven by the stakeholders within the marketplace, those that finance healthcare and those that provide it.